Yeah, thank you very much for the nice introduction, and I will tell you a little bit more about my experience about the Phaco Assisted Cataract Surgery, and it's short PACS, called from Oertli in this way. And I didn't expect any something truly new with the Phaco, but the PACS system was very exciting, and I think it's one of the next milestones in the Phaco surgery. So if we look back to the history of the cataract surgery, always a milestone is a combination of a technical innovation. So the first invention of the phaco tip was Charlie Kellman in the 60s, and he was sitting at the dentist chair, and this friend, the dentist, was cleaning up his teeth with the ultrasound, and then this was the moment he knew that this is the new technology for removing the cataract. And there are many milestones combined with the phaco tip and the vacuum. The pump system is very useful for removing this and effective. And we have a lot of inventions in the past decades, and especially the digital era in the last 2 decades improved the efficacy a lot of more. So I believe that the PACS now in 2025 is one of these milestones. Let's have a closer look to the phaco, and I believe that an effective phaco is only possible with an effective chop technique. And we have different moments in the surgery that you use the phaco tip on a different way. In the first moment, you would like to go in the first groove to have a good holdability of the nucleus, to be able to have an effective crack. And after that, you did do this multiple times, you would like to remove or grab the fragment, pull it a little bit in the middle, and fragment or conquer this. And we are able to choose the different phaco modes, and we there are different requirements for the phaco, and we would like to have a strong holdability for the cracking moment, but an effective conquer of the fragments. And the phaco tip it must be able to destroy the fragments, but also be gentle to the cornea and the corneal endothelium. So especially the phaco mode in the continuous mode is a little bit difficult to manage or control the low energy range. So this is the reason why Oertli developed the PACS system, and now we are able to control especially the low energy range of the phaco, and it's a linear manner, and so we are able to choose with the foot pedal very precise the level of the phaco, and that is truly new. Let's have a look to these videos, and you see on the left side the conquer of the fragment without PACS, and you see how the fragments are bouncing away, and this is the damage to the corneal endothelium, and there are some publications about that. And on the right side, you see the phaco tip with the PACS system, and you see how the fragment is sticking at the end of the tip without bouncing away, and this fragment melting down on the tip without any turbulence. And I think that is a big difference. Let's have a look to the foot switch, and you all know the 3 different stages of the foot step. With the first position is the irrigation, the second is the aspiration, and the last part is the phaco. And especially the last third of this foot pedal movement is a little bit difficult to choose how much phaco come in the eye. And I have filmed my foot pedal in the OR, and you see on the left side you have a sort of restless leg syndrome. You're always pushing a little bit because with a small amount of the foot pedal movement you have directly 20%. And that is the difference to the PACS system. You are a little bit low movement, you have a stable and precise control of the phaco, and you're staying more on the pedal like a cruise control. And I think it's a big difference to the old-fashioned phaco system. The traditional is not bad, but it's totally different. You will feel it directly in the OR. Let's have a look to the intraocular situation, and I mentioned already that I think that a shop technique is very effective. So the first segments cracked multiple times, and you have here a very good holdability of the fragments. But you see the air bubble is turning around, and it's especially at the end from the fragments to see that the fragments are bouncing around. Now you see it on the right side, and it's flying around, and I think that is not the best situation, and we can do it better. And now we see a video with the PACS system. And I cracked the nucleus in the same way. But it's a little bit difficult to change your normal setting to have the first grab. You have to push the pedal a little bit more than in the normal way. So it's very easy now to choose in the fragmentations, to grab the fragments and conquer these with a very low phaco energy. And you see that I'm working more with a fluidics, with a vacuum, and to grab the nucleus or the cortex, and you see how the nucleus or the cortex is sticking at the end of the tip, and we melt it down or conquer it on the very smooth, gentle way. And that the PACS system is very effective and very powerful. That is already published from Rupert Menard-Pace, and that is also a very interesting thing that Oertli has a good cooperation with a clinician, but also with a technical university of Lucerne, and there was this cooperation, and PACS was now the result of this very fruitful cooperation. How can we PACS use? And it is also available in this beautiful machine, the OS4 Up, and it's only to click here on the left low side, and I think it's if you have more question about the PACS system in the new machine, you have to ask the Oertli guys. But it's possible that you combine the PACS with every pump system, Venturi or Peristaltic, doesn't matter, speed. So I think it's very easy to change between these two modes. So in conclusion, or my conclusion is that PACS is very useful, lowering the phaco energy, and I use below 0.5 phaco energy with the first surgeries, and I believe that the holdability is very effective too, and I think you can enjoy surgery with the PACS much more than in the past. Thank you very much.